Hi everyone, welcome to today's webinar, Getting the World Back to Work. My name is Carla Cruz. I'll be your host today and we are joined by our presenter, Ernesto Perez. Before we continue, there are just a couple of logistical items I would like to mention to optimize your experience on today's event. We will have time at the end of today's session to answer any question, but please submit them anytime. You have a Q panel on the right side of your screen. Thank you for your time and your interest, and let's start.
All right, guys, welcome to today's webinar. We're very excited about this because it's one of the ways we can help make the difference in getting the world back to work. So I hope you like it. My name is Ernesto Perez. I'll be your presenter today, and we'll see different tools that we may be using in different applications for your depending on your company policies and your state or national regulations. Okay, so let's get started. So let's start with the agenda. What we're going to cover today is talk a little bit about what's the general knowledge of COVID-19, how can that be implemented with EAM, and how we can properly use mobile devices to provide that safety that is required by different health entities. We're going to see a lot of how KPIs can help us visualize the metrics, both of the either KPIs on indicators, or if we want to look at inboxes. We'll see COVID-19 tags that with the permit to work will be available for you to print out and have the different sections that have to be quarantine tagged. And then we'll see a little bit of what's a day in the life of Bob, and we'll go through EAM and see how he would be working on the system and how he can follow these protocols and make sure that he's in compliance. And then we'll see how easy it is to implement at this point, right? So the general knowledge of what coronavirus is at this point is that we know it's highly contagious, aerial transmission, so we need to make sure that we have all the proper equipment to protect us from the aerial agents that are obviously invisible. And they recommend that we keep physical distancing, right? So there's a lot of recommendations, and here I'm adding a couple of links that you can see for yourself and find. So there's CDC, there's the World Health Organization, and there's also the European CDC, and they're giving all sorts of documents, trainings, guidelines, depending on the industry, depending on how would they envision going back to work. So here are the links. So now moving to EAM, right? So how can EAM be a tool of service with the different protocols that are required, right? So we can do checklists, we can do non-conformities. So for example, when we're measuring the fever, that could be a good candidate to be a non-conformity, and that could trigger a work order or something else depending on how you set it up. There's also the service request and case management, where many companies may have their see something, say something policies or something to that line, where they want their employees to feel the comfort of being able to report whenever they see another employee just not wearing their PPE properly, or if they're not following their distancing, they can basically set up a service request so they can notify the company, and that can trigger an investigation. So there's also standard work orders, so you don't want to be creating a specific work order every time, so you can always go and just create a standard work order, let's say for decontamination, for quarantining an area. And that way you can track what's happening with that particular work order. And it's a repetitive process, so it can be just the same process, the same parts, the same everything, so that you don't have to work as much putting the information on the system as you are actually doing the job. There's also the document management where you can basically attach anything specifically to the certificate regulations, or if you're doing a particular protocol followed by a specific guideline, let's say CDC provides a guideline and you're attaching that so that everyone sees it, then you can always do that. There's always the permits, isolation points, and labeling, and we'll see a little bit more about that. But essentially, what we can do is select a specific isolation point, let's say a room or office or a floor, and then that could be your isolation points, so that when you're doing a decontamination, you know specifically what to tag, what to isolate, and then obviously what to decontaminate. And of course, the KPIs and inboxes are just a way to visibly measure and have a good sense of how we're doing specifically on all the COVID related protocols. So we're talking now about mobile safety, right? And mobile has a great advantage over paper and pen, right? The first one would be the cleaning competition, right? So we would say a mobile device is it's very easy to disinfect compared to a paper and pen, which you can only either throw away, or if you try and disinfect it with chemicals, it will damage the document. So it's always a challenge to keep paper clean, and that's one of the issues that they're recommending to reduce the paper that is moving around. Okay, so EAM has a strong capability of doing a lot of it. They are able to, so for example, we can set up a PPE, donning and dosing, according to the health agency. So if you find a protocol that you want to have your employees follow, let's say every day, you can create that, and then you can also have your hazards and apply those precautions. So in the case of a precaution or a hazard in the COVID-19, is obviously the hazard would be the contamination of an area, right? And maybe we can say, so precautions would be wash your hands, clean those surfaces that have been in contact with different people, um, keep your social distancing, and so on. And then there's also the permit to work, where we can do the whole isolation and create the tags. Okay, so talking about KPI definitions, we've managed a lot of how we can look at different KPIs in the system, right? So in this picture here, we see a couple of them here. And essentially what they're measuring is how many call center tickets have been created, how many cases are created. So if you created a call center ticket based both on emails or calls, or if you have the service request, then you can have that automated to create tickets. But also you can create a case based on that call center ticket or a work order, and that would also trigger its own particular permits and so on. So that measurement is all being tracked here. So here is an example of a quarantine tag, and what we're saying is, okay, so you're establishing your permit to work, and you will find that this particular tag is going to be in a particular area that needs to be either quarantined because there was probably let's say there was a positive case, or if you're looking at decontamination tags because that's a routinary, or That's something that because of a positive case, we're looking at different areas where the particular employee was in contact with, maybe they were on the rest areas. They were obviously on their workstations, and they were way in between those two and the exit. So those areas all need to be decontaminated. And then there's always the caution tag out, where we just want to make sure that everyone's aware that this is a potential area and you need to stay away because it's something that maybe that we have the suspicion that there's contamination here. So for example, if you're looking at a potential positive case, that would be a good label to use. Okay, so now we're going to look at a day in the life of Bob, and what we're going to be doing is move to the mobile device so I can show you guys the setup here. Okay, so this is what let's say we're starting with his day. This is Bob. He's a production supervisor. He's in the manufacturing plant industry. And let's say he's doing his initial entry of his crew, right? So he probably gets in a little earlier to make sure that he's properly wearing his PPE and he's properly disinfected. And then he can monitor the other guys in his crew to follow the different protocols that were established, right? So what we can do is we can look at the work order. Let's say we want to start the activity, and then we can just go to the checklist, and then let's say that you want to make sure that everyone washes their hands, then complete. Is everyone complying to their distance? Yes. And we can even take a picture. So let's add a document here, take a picture and attach it. And let's say we're taking a picture of what's the distancing looking like right now. Okay. And then we close that. And then we fill all of them, and then they can be checklists, they can be values, they can be quantitative or qualitative. So you can specify what's your particular rating. Okay, so for example, in the particular body temperature, we can say yes or no. So we're looking at, okay, so did anyone mark over 99.5 Fahrenheit or 37.5 Celsius, which is what is established as a high temperature on the body, right? So let's say this is a bad day. Someone measured that they have some sort of a fever. So let's say yes, and then the range, what we can do here is say, okay, so I measure him and he's actually 99.8. Okay, so we need to create the node that we need to check his, wait, sorry. And then we can attach that as well. And let's say you have more than one person, you can always just save this one and create a new one. Okay. See, so it creates a new one here, and then you can add another value to it. So, okay, so this one was 101. Okay. And then let's say that this is the final occurrence, and that's it. Okay. Now that we're done with the particular follow-up, we can stop the clock here. And what we are going to do is, obviously, we're not going to take their names and add them to, sorry, we're not going to take them and add them to um, a particular database, right? We're not going to uh, disperse that information of the employee. So what we can do is we can create a note on the notebook, and we can say, okay, so I measured John and he's in 99.8, and this notebook is actually private. So I can just make sure that everyone on the database is not able to access this notebook. So this is a personal note. And let's say I want to forward this to EHS. So this can be done by different ways, right? We could specify a specific status for the work order. So let's say if you want to do a non-compliant work order, that's an option. But you can also just say, okay, so since this is not something I want to keep on the database, I'll just forward an email personally and just say to the EHS team that they need to make sure that everyone is compliant, right? So what they can do, and now I'm moving back to the computer. So what they can do is they can just create a case, because this is not yet an investigation. I mean, this is not yet something that they're going to act upon, right? They're doing just an investigation. And the investigation could be, okay, so we send him home and we're doing a lot of what the different protocols require, right? So let's see on the comments, you can say, okay, so we measure the employee and he has high temperature and was sent home. Then after that, when we found out he's probably positive, or if we're just wanting to avoid future contamination, then we are just tracking or tracing what's the previous contact with different employees, different areas, and then we can proceed to decontaminate the area based on the findings, right? And let's say he was found positive, then we can attach documents and so on. So the challenge here is, once we're sure that we need to decontaminate an area, how can we create a work order that will track that? And let's say we want to make it fast, right? So this work order here is where we created the investigation from. So let's say Bob sent an email, said, so the work order 66295, you need to check it out because the employee was not the range of temperature, and we need to make sure that every area is clean before we continue. And then here we can just create a follow-up work order that will show the particular scenario where we need to decontaminate the area. So what I'm doing here is I'm selecting a standard work order. The standard work order is actually a template which would include the description, work order type, anything that you would need in order to get the work order going with the minimal effort, and we'll see that right now. So when I right click, we can create a new follow-up. Okay. So now let's move to the work orders, right? So let's look at how the work order is created, right? So once we have the work orders, and this is the standard work order, we have the C19 deco, which would be the decontamination process. And notice it brings all the information and brings all that here that was already preset, okay? Now we can look at activities. So the activities basically are going to say what needs to happen, right? So are we wearing our PPE? So when we are starting that job of decontamination, we start with a new PPE set. So we're going to wear that then we are going to decontaminate the area and we're going to remove the area, the PPE, sorry. And then we can also have a set of parts, which would be your material list of the parts that are required: hand sanitizer, protective gown, gloves, mask, etc. And then the other thing we can look at is the safety, which would include the particular protocols or hazards and precautions that need to be taken into account. So you need to make sure you're washing your hands, keep your distance, avoid touching your face, and so on, right? And then we can also look at, we can also look at the permits. So the permits will establish how the different isolation points based on the equipment, which in this case is the floor, the whole floor of that building. What we're doing is we're basically capturing not only the floor, but if the structure is properly established, then you can even go to the room by room uh, specification of that floor. So when we go to the particular permit, so when we go to that particular permit, you will see the specific isolation points that are available for the technicians to either isolate, decontaminate, or just have caution, right? Depending on the standard work order. Okay, so we have the permit here, and the permit is also pre-configured. So everything that I'm looking at here is just created by looking at the specific work order that we just looked at. Okay, so let's look at safety. And again, we can see the particular hazards and precautions. And in the LOTO, we can see the specific isolation points related to each room that is under the floor. So let's say you're doing everything as you see here in the labeling: floor building one, floor one, and then you have the M1, M2, R1, R2. So you have all the different components here that are within that floor. Okay. Now let's look at a particular report that is generated based on that permit. Okay, so when you look at the information on the report, it will include the hazards, the precautions. It will also include what's the equipment and what's the particular isolation point for that equipment. And all the way down here in the bottom, we'll see the different tags that are developed, right? So this will help when you see this label, you can just print it out, paste it in the wall, and that will alert the people that are going by and make sure that they're just sure that the rooms or the equipment is properly tagged. Okay. Now moving back to the mobile device, we can see the particular setup that is in the mobile version. Okay, so now I'm in the mobile version and I'm looking at the standard work order that was just created by that case. And as you can see, the information here is already preset, and you see all the details here. And if we take a look at the different activities, what they're representing right now is just having different specifications for different tasks, right? So in this case, we can look at putting on your equipment and then decontaminating the area and then taking it off, right? So let's start with the clock right here. And then we also can look at the checklist. Okay, so we have 5 items and we can start with the first one, and then We can look at the comments to see instructions if there's any. And then we can go back and then say, okay, so I completed this. And then you can say, right? So just to make sure, right, you want to be 100% sure when in these cases, right? Now, going back to the actual activity, and of course you can fill all the information there, but you can also take a look at the safety hazards and safety precautions. So in this case, we have a particular hazard, which would be any contamination against, in this case, related to the COVID. So, and what you can do is select the precautions and just select, okay, so I put on my, I'm not touching my face, I'm maintaining the social distance and all that, right? And then you can select those and save. And basically you're saying, okay, I applied all the precautions, and that's a good way to make sure that you're being compliant. Again, that's the whole focus of this. Just track all the right steps that you're taking. Okay. Now, the other thing that you can do is you can go to the actual permit to work, right? And specify or see again, you can see the safety, the hazards and precautions, but you can also see the logo and the isolation points, right? So when you're doing your isolation, basically, like I said, you have a good structure. Um, so in the whole floor, you have all the rooms that need to be labeled, and those need to be isolated as well. So what you can do is you see all the isolation steps here and the isolation points, and then you can say, okay, so they're isolated, and I sign it off as certifying that it's isolated. And the same thing can happen when you need to de-isolate, right? So that helps you when you're, again, documenting this information and just tracking all the permit process and all the safe protocols that you're following, right? Now, the last thing that you may want to do is say, go back to the work order, and then on the work order, what you can show or have either your someone on your team or yourself is to sign it off. And if you're on the mobile version, this is a pretty neat feature which can enable the user to sign it off, right? And then submit. And what it does is it attaches that particular document right here, and you will see the document signed. Okay. Now, going back to a day in the life with Bob, right? So this is essentially what we need to track in order to go through a day, right? Let's say this was a bad day, right? But we're doing that initial entry. We're doing that specifically whenever we need to capture the information properly, right? So let's say a good day would be just work order, and then that's essentially what that is. Okay, then when it's a bad day, then you have to go through this process or something similar to drag all the information. Okay, so moving on. The good thing about EAM is that you can just have that import utility and have an Excel sheet that will just create um, the particular documentation or data to upload. So you don't need to create something or redesign the wheel. With the import utility, we can basically do a quick implementation that you can start using fairly quickly. Okay, so this would open a space for a safe environment and clean work. So let's say we're going back to work, so and we need to take these things into consideration, right? After we're moving with the protocols, we'll just and one of the recommendations that CDC is providing is that you establish a plan, stick to the plan, and then monitor and review that plan depending on if it's required, right? And that will help you make sure that you're using the tools properly. So this is all I had for you today. And I think there's a little bit of time for questions, so we'll just wait for your questions. So thank you very much and have a good day.
Thank you, Ernesto, for the presentation. And to get started with the incoming questions we have, does any of these require additional licenses?
Okay, so this is a fairly simple case management and work order setup. Checklists can be pre-configured as PM schedules, maybe a daily PM that is released, or a set of PMs that are released depending on the shift. Or if you just want to have a standard work order created on demand, you can also use operator checklist and non-conformities, but these are all modules that are within the system and with brief configurations can be used for this.
Okay, thank you. Another one says, what additional functionality can be used for this effort?
Okay, so additional functionality, we can use work request, you can use service request, call center, and rapid request for for having to have people to not to have people the people who have the availability to notify the issues. You can also set a particular workflow that enables triggers, let's say talking about emails, right? You can talk about how you want to manage the flow in this particular case, right? When you have a situation where you need to decontaminate something. But remember, these solutions are really not written in stone. So they are actually tailored to your company needs. So the functionality varies depending on how you want to manage it.
Okay, and another one says, how can values like temperature trigger a work order?
Great question. So you can set up non-conformities to act depending on the range. So for example, if it exceeds the 99.5 Fahrenheit threshold that you are establishing, it can create a work order or just say this is not this is a non-conformity, but you don't really act upon it automatically, and you would need to do your manual process and all that. But you can also go to our website and we have a specific session dedicated to non-conformities, and it talks all about how it's actually set up, and you can see how different applications, not only for this situation but others. So
Okay, thank you, Ernesto. And this webinar is recorded and we will distribute that recording out to you. So if you want to share this recording with your colleagues or someone of your interest, you're free to do it. We will have other webinars if you want to register or have more information, you can contact us. We hope this webinar has been useful. Happy afternoon, everyone.
thank you, Carla. Bye.